I was trying to figure out what could I do to describe where we are and who we are. So I said, okay, let's take a person's lifetime, from child to teenager to adulthood. Let's place hospitals in those same three brackets. In the childhood, let's take hospitals that are 25 to 75 beds. Take now teenagers. It's probably a hospital 75 to 150 beds. Now let's go to the adulthood. What is that, 150 beds, 300, 500 beds, whatever it might be. We're a teenager. Now some people may not like to hear that term, but I'm just using it to put us in a place where we can at least think from and try to move forward.
They don't have to work here, but they choose to stay here because it is about the people. You know who you're working with, you know who the people are to turn to when you need them.
Clinton Memorial Hospital is a place where you have an extended family.
That's what it's all about. It's people taking care of each other so that we can take care of our community.
In many ways, the patients take care of us as much as we take care of them. It amazes me as much as they are hurting that they're asking questions about how our kids are doing.
Patients, former patients, see them all over the community. It's always heartwarming that they remember me and I remember them.
It's been very rewarding for me. I think it's the patients that I take care of. I think they are genuinely very honest and caring individuals.
You can see people recognize something very serious and then 4 weeks later share the joy of them being back home with their families.
Where would they go for their care? They'd have to drive to Cincinnati through all the heavy traffic, that's 45 miles away. Have to go to Dayton, which is 35 miles away. And Columbus is the other choice, 75 miles away, or maybe 80 miles away. Nobody likes to drive 70, 80 miles for their care.
They're not that isolated hospital that's out there in Clinton County. They're part of the family. They're part of the quality of life that we have here in this community.
It's so important to keep our community connected in this complex healthcare system that we are in. You know, not all communities have a CMH.
We have close alliances, and we pride ourselves in identifying when something does need to be at a tertiary care center.
We have access to resources for those kind of specialties we can't offer here and probably shouldn't offer here.
But we also know that if we don't have the capability, then we'll send you to where you should be taken care of. Now, Cancer Center was well thought out. We said we would see 200 patients. Instead, what has happened is, because it's gone so well, we have 345 patients we've seen in the first 11 months.
We have a very progressive and top-notch cancer center here that you couldn't find in even the biggest cities.
Very broad and all-inclusive approach, including medical oncology, radiation oncology, but importantly, comfort care, alternative therapies.
It's very much team-based approach to cancer care. Holistic, whole body, mind, body, spirit, psychosocial needs, family needs, the whole ball of wax.
That's also one of the reasons why this is truly unique, because we now have the opportunity to treat local folks locally.
One night I was really tired and she said, "I think you need a back rub." And she didn't have to do that.
I sort of always had the feeling that it wasn't as professional as the care you might get in the city. After having the surgical procedure here, I was very impressed with the care. I was very impressed with how professional everything was handled.
Techs that did the radiation were so thoughtful. One morning it was freezing rain and it had gotten slick, and one of the techs said, "Let me move your car for you."
What's the most annoying thing that takes place in a hospital? The overhead speaker. Will so-and-so please report to? Will so-and-so do this? We don't do that here. Basically, we use cell phones.
Everything was so clean. I mean, they were always cleaning up.
There was a technician that covers hospitals in the tri-state area. So this is the cleanest hospital that he visits in the entire three-state area. You go back to that teenage who in the hospital. If you're going to bring a new service on board, you better be careful and make sure that every dollar you spend is going to give you some kind of return down in the future, because you don't have that much money to offset if you blow it.
People understand what it's like to have a primary care physician, and Wilmington still has a primary care base. Here, it's the norm.
We're seriously committed to the best technology, high quality of care, and commitment to their needs as humans.
They truly do care about the patients that they have.
I couldn't imagine being anywhere else. This environment that CMH has provided has allowed me to grow in ways I never dreamed I would grow 30 years ago.
They stay here, they make a living here. People have been here for 25, 30 years. That's dedication.